Hello, my name is Christina Pai, and today we're going to be discussing intestinal atresia. Now, intestinal atresia simply is just a partial or complete obstruction that can happen anywhere in the intestines. Stenosis is a result of the narrowing of the lumen. There are four different types of intestinal atresia, or IA for short, and they're each named after the affected area. There is pyloric atresia, duodenal atresia, jejunal atresia, and colonic atresia. In pyloric atresia, the obstruction is at the pylorus, which is the passage between the stomach and the duodenum or the small intestines. This type of IA is very rare and it generally occurs within the family. It's passed down, and babies with pyloric atresia will vomit the contents of their stomachs and develop a swollen upper abdomen due to the buildup of their intestinal contents and the gas. Pyloric atresia is generally treated by surgically opening the obstruction and repairing the passageway back to the stomach. Duodenal atresia is when the duodenum is obstructed. Nearly half of the infants born with duodenal atresia, are born prematurely. Two-thirds suffer from cardiac, genitourinary, and intestinal tract problems. Nearly 40% do have Down syndrome and usually do vomit within a few hours of being born. Duodenal atresia and stenosis are both treated by connecting the blocked part of the duodenum to the portion of the duodenum just beyond the obstruction and opening, the airway, the way back up. Jejunal atresia is a congenital bowel obstruction occurring in one of two different parts of the small bowel, and it's either jejunal atresia, which is the blockage of the jejunium, which is the second part of the intestine that extends from the duodenum to the ileum, or it's the ileoatresia, which is the blockage from the ileum to which is the lower part of the small intestines right before the colon. Jejunal atresia requires the removal of the blocked intestine and is sutured back together with the colon, or I'm sorry, back to the bowel. Colonic atresia occurs in less than 15% of babies with IA, and colic atresia is when the bowel becomes extremely dilated and often has the same signs and symptoms as jejunal atresia. Um, Colonic atresia is treated by removing the dilated colon and are given a temporary colostomy. However, there are times, very rarely, when the ends of the colon are sutured together. Regardless of which type of IA newborns may experience, there are signs and symptoms that can happen both before and after birth. Before birth, the mother can have an ultrasound and it can show that the baby has extra amniotic fluid inside the mother's womb, which is called polyhydramnios. Polyhydramnios, and this happens when the baby's bowel doesn't absorb normal amounts of amniotic fluid. After birth, within the first 1 to 2 days after birth, the baby may experience one or more of these symptoms: no bowel movement, swollen belly from gas, yellow or greenish vomit, and not wanting to eat. Intestinal atresia, which is located in the duodenum, is due to a problem with how the first part of the small intestine or small bowel developed before the birth. Babies with this condition, like I've said before, may have also have Down syndrome or heart problems. IA and other parts of the bowel are most often due to insufficient blood supply in that area before the birth. Intestinal atresia, clearly it affects newborns and it requires surgical treatment regardless of which type of IA they have. The prognosis for IA is after surgery, the baby will spend 1 to 3 weeks in the hospital, and once allowed to go home, there needs to be a follow up with the surgeon and a dietitian to ensure that the child is feeding well and gaining weight. The incision should be healed by now. But just keep in mind if the child had a duodenal atresia, then they may have other health issues. Like I've said, might have Down syndrome. There might be heart defects, and babies with other IAs, they should generally be healed and have no further health issues. and they should grow up perfectly fine. And if you want to just follow up on anything that I've said today, you can check out chp.edu, cincinnatichildrens.org, chop.edu, and lifespan.org.